dorsiflexion. Was that good? Was that a solid? Okay. Okay. Plantar flexion, dorsiflexion first. Active, passive. Active would be go up, dorsiflex your foot. Plantar flex your foot. So that's that. And then you can do it passively too. What does that look like? And then rest, and then just looking at the plantar flexion end range action there. Dorsiflex.
Are you always doing passive?
No. You always want to do active until you feel comfortable assessing passive. And then also with foot mechanics, I always assess. I do assess passively. Also.
That's the criteria I would want your approval before I would do anything passive with somebody.
Yeah, well, you want to, I mean, one, they have to have a high allostatic load, and then two, you want to feel confident, moving people. Load? Thank you. Low allostatic, low allostatic load, high allostatic score, and then two, you want to feel confident, moving joints around. So, as you get your chops up and you feel better about doing all this stuff. Yeah, but I rarely assess passively at this point.
Right. It's just like our feet really things you do.
Yeah, and you gotta think about it, the one joint in the body that's passively loaded almost constantly is your foot. Right. The hip isn't, knee isn't, unless you're passively testing, femoral acetabular compression, which you don't really need to do that for much. So, yeah, but with the passive stuff, there is benefit to it, right? Because if they're if you're bring your leg out, and they bring their leg out, and you see that, and you're okay, if it's somebody high performance, Steven is a guy that I do passive with a lot, because his allostatic load, he's like a pickleball tennis psychopath, and he's just an animal, and so with him, it's okay, I want to see how far I can take this dude at this point. So I'm here and I'm yarding on his leg out here. I'm keep it out there, ready to go. And I'm testing him pretty stressfully, but you don't want to start with that.
Is that a performance level?
He's at a performance level. He's got no pain, and I'm having him throw balls at walls really hard and run around like a crazy person. So, yeah.
Okay, thank you.
Yeah.
I appreciate that.
Point the foot left, so that's rear foot inversion. Point the foot right. That's rear foot eversion. That's active, rest, and then this would be the passive component. So I'm kind of cupping the heel and cocking with my hand. Cupping the heel, cocking with my hand. Don't expect a lot of range out of this direction here. You don't get a ton. Cup the heel, cock with the hand. Cup the heel, cock with the hand there. We have forefoot.
So are you doing, when you go to do this for the assessment, are you looking at the range of motion, but also the quality of the movement?
For sure.
Sticky, then you're okay, that's different.
Yeah. Yeah. If I'm jammy, and I'm oh, nice. Okay. Jammy. I mean, you can feel that, right? It's
yeah.
See how it moves?
Yeah. Yeah. Yeah, I can feel that.
Should fall?
That's stuff. Right. Yeah, so I'm okay, loud. That's loud. That's fine. Ooh.
Is that getting better?
No.
Okay. You're going in.
Yeah. So inversion feels similar. Eversion is not
what
great.
would you call this for a number?
I don't know. I'm gonna have to redo this foot thing again, I think, because what I typically write is in the notes, rear foot eversion.
So be more of there's an issue rather than a 1, 2, 3. It's yes or no.
Yeah, kind of. I mean, once we have a data entry slot for that, we'll have that. I think in Greg's it is. What is it? It's forefoot eversion, subtalar, abduction, adduction. I think that's it.
Or I just mean in general for the foot stuff, because it's such a minute difference.
Oh, what would I call? Oh, I see what you're saying. Oh, this is a 1 for sure. Yeah, and I would say jam.
Okay.
Yeah. It's tough with the passive too, because you're not seeing quality of motion.
Right.
So I would definitely just circle and go, yeah, that's pretty significant,
Mhm.
something like that. Yeah, just so you remember it, and I gold star it because that feels pretty jammed out.
Mhm.
Actually, it's starting to move better.
Yeah.
You had it that fall,
Starting to move
right,
a little bit.
Eli? Where you landed.
It was on both feet though.
Yeah.
So
So
maybe the force just went equally distributed through each of your.
I think it's hard to tell. It was
Yeah.
10 years ago.
yeah, so I mean, the things I'm looking at are rear foot. How does it invert, evert? How does it plantar flex and dorsiflex? Forefoot. How does it invert and evert? And then first metatarsal head. How does it plantar flex and dorsiflex? Right, and then you can. I mean, if you want to get, this is the thing, right? I mean, you can look at that. We should probably put that one in there. That's interesting to look at too. How's that fifth move?
Mm-hmm.
How does that fifth move? Oh,
Whoa.
shit, that's not good. Yeah, I'll redo this because that. I mean, that
Or
feels.
you
That's
just
like
because you just have the
super
first and the second.
Yeah, and then I have phalanges, but that's crazy.
Any foot pain?
No foot pain.
No foot pain.
But
It's starting to move better.
it is, yeah.
Nice little suggestion there.
Like this feels like you're just like moving. This
I'm
feels like
having to
my
move
leg-
through some
my leg
sludge
is
a
kinda
little
going-
bit. Yeah, I agree. I mean, I feel like yeah, your whole thing is moving there. So yeah, plantar flexion, dorsal flexion, toe flexion, toe extension. I usually look at that first, and then I look at these lateral guys. Look at the first, look at the lateral guys. Look at the first, look at the lateral guys. Look at the first, look at the lateral guys, and then I kind of look at this like forefoot adduction, abduction thing. How's that moving? Doesn't feel great. How's this move? Way better.
Mhm.
You feel that difference? That's crazy, right?
Mhm.
And then, I mean, that's kind of like for me, if I'm like banging, and this is the thing, when you're doing it passively, I can just be like,
Mhm. Right.
okay, oh, that was weird. Okay,
You should write that down.
boom. Okay, cool. Cool. I mean, I'm not doing it that
Mhm.
quick, but you know,
Yeah.
you can go through this in like 3 minutes. Go for it.
I'm,
You
not,
good?
I'm
Okay.
just watching.
Yep. So that's what I would think about is like starting calcaneal,
Mhm.
move to kind of tarsal forefooty,
Mhm.
and then distal phalangeal business.
Okay.
Yeah, and you can look at, how's the toe do stuff. In, I like looking at in because it kind of, that's that supinating stuff.
Yeah.
You mean like going to the midline?
Yeah.
Behind.
Going
No, the
abducting away from midline of the
Yeah.
foot. Yeah.
So at what point would you do this screen? Or are you just doing the foot screen? This is
Uh,
not the
wh-
whole initial assessment? Or is
This is part.
is
Yeah,
part of-
this is part of the assessment.
Okay.
Yeah. Yep.
This is like
Definitely.
on the first page of range of motion.
Yep.
Okay. Cool. So just to kind of connect this now with treatment. So
Yep.
we know, let's just pick one of these things that I was local about treating.
I love it. Let's. Yeah. Do you want to try any of this assessing of the feet too?
Yeah.
Okay. Do you want to do that
This
before
is-
we go treatment, or do you want to feel some treatment?
I'll do treatment first since I'm
Okay.
right up here. Or I guess Julie, do you want to feel
Yeah.
that stuck some of those? Oh, so there was like 3 things we found stuck.
Yeah.
I think I just wanted to, if you like, I get the rear foot eversion, inversion, and then the forefoot, where you're kind of more here.
Yep.
Is that the?
It feels like you're kind of in the middle rather than one side, right?
Let's do this here. Okay. So I'll do this foot and you do this foot. Do you mind if we spread you open a little bit there? Okay. So here and here,
Mhm.
dorsiflex. Do they feel the same?
You're going further.
Okay.
I think that's just because you're not wanting to hurt it in passive. I think that yeah.
Right there, and then go. Oh, I'm on the other hand.
Oh,
Yep, there you go. Those feel better, more similar.
You could probably go more, Julie.
You gotta remember, this ankle moves passively, right? So it should be doing this.
I'm not used to that.
So putting a lot of force in it.
Right.
I mean, think about when we walk, look at that angle.
Yeah, and how much weight
Right,
is on it?
that's 100, 200, 210 pounds.
Yeah.
Okay.
110 pounds. That's
Okay.
it.
Okay.
Alright, and then we're here, and I just go, okay, cool. And I'm not hammering this too much. The reason I'm not hammering plantar flexion is because when are we ever passively in plantar flexion?
Yeah.
Never. I'm being real gentle with that because you can piss off that Achilles tendon, you can drive that calcaneus into the tibia. Like, not fun. There's a lot of soft tissue junk going on there. Right here, this thing is like it's designed to do that. This is our shock absorption system right there.
And that goes with like the whole ballerina thing, which is not typical at all.
Right,
To be up on
the plie kind of thing. Yeah. So, and then we have cup in here. Yeah. Yep. And then cup in here. Yeah.
Okay.
Feel that one just so you can feel the difference of those two.
Yeah. Wow.
See how I can do this without having to like brace him or anything?
Yeah.
And over here, when I do this,
Yeah.
like I want to like anchor here and like twist him to get him out there. Whereas here, I feel like I can just.
Well, he's not going. I mean, even if you did anchor him, it doesn't.
That's
seem
what
like
I'm
you're
saying.
gonna-
That's what I'm saying. I'm having to like anchor him hard and like.
Yeah.
But that's hip rotation that we're doing pretty much, right? Do you want to feel that?
Sure.
Yeah.
You're good with the. So I should do this one first.
Yeah.
So like internal rotation.
Yeah. That's.
And give me feedback if I'm doing too much.
That's the calcaneus here. Ooh, we should probably. I think me and you are gonna go. We'll probably need to get into the nitty gritties of this stuff.
Okay.
Yeah. Yeah, we'll have to do another round of course. Yeah. Yeah. I just want her to get ready for.
Yeah.
Positional
Right.
testing, yeah.
Yeah. So yeah.
Okay, that sounds good.
Yeah, and then we have.
The forefoot. Okay, that was rear foot, and then forefoot.
Yeah, so basically we cover those four positions there,
Yep.
and then we have calcaneus braced, and then we have. So yep.
So you're doing midfoot?
Yep.
So heel, forefoot,
Yep.
midfoot.
4-footy business here. And then you just want to keep this still.
Okay.
There you go. Yeah, nice.
Okay.
Cool. Very good. Yeah.
Alright.
And then in and out, in and out, in and out. Don't let the heel move. Very nice. How's that feel?
That's good.
Very good.
How's that feel, Eli?
Great.
It's like my joints. Back to my joints.
No, we can go for another 20 minutes.
Actually, it's not doing very good.
And then we have first metatarsal brace.
You need
here.
more practice, Julie.
I do. Yeah, don't trigger my massage hands, please.
They're
Please.
crazy. They're crazy. Sometimes you'll be like this, and I'll be like, what? And I'll just like go in.
Massage.
Like, do I need to retract this? And I'm like, oh
Yes.
my gosh.
I know.
I'm,
Well,
like,
you did that the other
melting.
day. You gave me a little hug. And you're like, it's okay. And I was like, oh, wow. Oh. You would have been a really good massage therapist.
Yeah, probably.
Really good.
We need to do like monthly massages.
That sounds amazing, man.
Okay.
Okay, so first metatarsal head, dorsiflexion, plantar flexion, dorsiflexion, plantar flexion. There's that.
How's that feel?
Wow.
My placement, like
Cool.
right here on the head?
And then I like this. I think we're definitely throwing this in. You need to brace here,
Mm-hmm.
and then this guy.
Yeah, this guy gets smashed.
Yeah, that's no good. We gotta get that fifth going, and then toes. So
Okay, so you did first, fifth,
yep,
and
and then toe flexion, and then the other ones. And I'm just kind of like how they do. I'll brace here and go like, okay, how's that look? Right here, Julie.
Mm-hmm.
So you want to be off the heel now because we want to brace the vents. Yep. And then I'm here, and then here. Yep.
This little piggy.
Seriously.
Okay.
And then here,
See, all these years my mom was embracing my
Mhm.
heads when we were
Mhm.
doing little piggies.
and there. So there you go. And then in, I like to look at in too, just to see what that is.
Okay, so you're assessing plantar flexion of the
Yeah,
first
and what I
phalange.
typically do in the assessment is I just go like big dog. I'm just like, how's that? How's this? And then if I'm like, ooh, there's some junk here, then after reported findings, when I'm like, explore first metatarsal head or first phalangeal flexion, I'll be like, okay, where's it coming from? Is it
Like,
distal? Is it proximal? Is it middle? Is it distal? Then I'll go into the nitty gritties of it. Is it that the first metatarsal head doesn't want to flex, or excuse me, extend? Like, you know, then you can look at this stuff. But really, when you're doing the assessment, you're like, what sucks? That feels great. That feels weird. Okay, I want to look at whatever's going on in this first ray. I need to figure out what's going on there.
and then with the in.
Yep.
Can I just come over
Yeah,
here?
of course.
So at any point where if Eli were to be like, I'm in a lot of pain there, stop the assessment and
Well, I would just be like, what? Like, I mean,
Where's the pain?
yeah, where's the pain? What's going on?
Does it
I wouldn't
linger?
stop the assessment. I'd be like, what's the pain feel like? When does it happen? Is it when I do this? No. Is it when I do? Ooh. Okay, there it is. Oh, it hurts when I do that. Okay. Does it hurt when I do this? No. Does it hurt when I? Ow. Okay, so it's second. It's first middle phalangeal extension that totally pisses his system off. That's
So-
great. Write it down.
drill it down, find where it is.
When you're assessing this fifth and the first, are you down here? Or are you
There. No, sorry. Calcaneus.
okay?
Wait. Let me see. Let me check.
I think you are.
Yeah, you gotta be here.
Okay.
Right, because if you block here,
Yeah, you're blocking.
you're
that.
blocking the whole field there. Yeah.
I feel like the fifth.
His fifth on his left is crazy. But I've never even assessed phalangeal flexion extension of the fifth
Yeah.
until
I mean,
today.
it's moving a lot
That's
more
why I
than the
love this
right,
shit, man.
right?
Yeah, way more.
And as Julie
New
was
foot
noting, it was getting better as you guys were working some of
Yeah,
this.
some
Are
better,
you saying that
some.
this is moving better on my right
I agree.
than on my
Just
left?
the assessment in and of
The
itself.
fifth,
Yeah.
big time. And I feel like you're.
It's starting to move better, but at first you're like, wow, it's locked. Because
The,
to me, it
the
feels
left was.
it moves
his
better
left.
than this, but this right one is starting to. I mean, I can feel.
His left foot was moving worse.
Oh, because it's moving really good now.
The fifth?
Yeah.
Oh, that's great. That's crazy. If that was what was moving
It still
junky.
feels more stiff to me.
Let me see.
Maybe I'm not doing it right.
Do you know?
Dude, that feels like it's moving way better.
It does feel like it's moving better.
Like, way better.
Mm-hmm.
Like crepitus and popping and stuff? Do you
This
know
almost
any?
feels like it's moving worse now.
What are you doing? What is your nervous system doing?
That feels worse now.
Mm-hmm.
That up. The down feels fine.
Yeah.
That up compared to this.
Yeah.
Yeah, no, I agree with you now. That feels tighter or more blocked out.
Yeah, the up part for sure.
So like when we first looked at this thing felt like it wasn't doing anything.
Mm-hmm.
Yeah, you feel how the up is getting capped out?
Yeah, that's the part that feels
Yeah.
stuck.
No, I agree.
And that was what was confusing me. 'cause
Who
the
were you
bottom
seeing
part was
today?
good.
During my spot.
Jonna
Oh.
Christensen.
So Jazz, the other one was the rear foot. I think it was E version.
Mhm.
So we're gonna look at treatment for that.
Yeah. Cool. So bend the knee. So I would just QMAMC at first. So bring that foot down into neutral, resting, kind of plantar flex. Yep. You okay there? So we can do this passively or actively. Slide your foot out towards me. Good. So he did that well by himself. That's great. So I'm gonna have you maintain this position. I'm gonna be pushing him this way.
Okay.
Keep your foot to the right. Ready. Go. Good. Rest. How'd that feel?
Hard, but
Okay. Point the foot right. Keep it there. Ready, go. How'd that feel?
okay.
Okay, cool. Rest. And then bring your leg up. So those are high quality. I would just check it passively too, just to see how
Okay.
that feels. Keep your foot to the right. Ready, go. Yeah, he's got it. So that's not an issue. That everted thing it feels fine to me. Bend the knee. So now we can look at eversion and first metatarsal head flexion. Bring the foot down. Keep it down here. Ready, go. Not that. ready, go.
Okay.
Not that, ready, go. Not that, ready, go. Not that, ready, go. It's getting better, but there's that. So let's check this one too, comparatively. Ready, go. Ready, go. Yeah, he's curling his toes. Point your toes up. Keep that foot down. Ready, go. There it is, dude. Nice. How'd that feel? Let's compare that again to the other side. Point the toes up. I can feel you trying to do that with your hip. You feel that? So go toes up. Keep that metatarsal head down. Ready, go. Yeah. So now the question is like, is it a hip extension issue or a metatarsal head issue? Keep the heel down. Ready, go. That's not a hip extension issue. So that, but the crazy thing, keep that metatarsal head down. Ready, go. That metatarsal head, I'm barely pulling on him, by the way. Ready, go. That metatarsal head is destabilizing his whole hip complex. Keep your heel down. Ready, go. Keep that heel down. Ready, go. I'm not moving him there. Ready, go. Feel strong, right?
Are you putting your, are you flexing your first metatarsal head?
No, I'm just asking him to drive heel. Yeah.
Okay.
So now if we want to treat this metatarsal head, I'm just going straight for it. I mean, I would probably look around a little bit more, right? I could do that. So go toe curl. Stay down here, ready, go. And that feels compy to me. Okay, rest.
Like rotatey.
Yeah. Keep that foot inverted, ready, go. Yeah, that's good. So this is kind of cool, right? Because what I was seeing here was that there was some first phalangeal junk going on. So this is lining up with this metatarsal head. So go for it.
We didn't go into plantar flexion though. He was dorsiflexed and then
No, he was
everted.
bend the knee.
Did you do plantar flexion?
And eversion, yeah.
Okay.
Yeah, I did. Yeah. Yep, down here, and then I had him point his foot right. Ready, go.
Okay.
Right there. Now we didn't check this, right? So keep that first met plantar flexed, ready, or flexed, ready, go. Ready, go. Not great, right? Try this side. Ready, go. Yeah, okay. That's pretty different, huh? And so I'm bracing here and I'm pulling here. You want to try that?
Yep.
See what that feels like?
Ready, go.
Was she connected to you the whole time, or did she start off you?
I think she was connected, but it does feel a little different.
Let me see here real quick. So I'm going here, force coupling, pushing down, and then letting off and pulling.
Okay.
Let me show you here. The figures there. Yep, and then let off with your pad as you pull.
Okay, ready, go.
How's that feel?
Yeah,
How'd that feel?
Yeah, I mean, I feel solid though. Just
Yeah.
a weird thing.
Feel high quality?
Yeah.
okay, can you do that again? Ready, go. And then you lift up.
Felt high quality to you?
Because if you're down there the whole time, you're like, what am I
Yeah.
doing? 'Cause
Keep it down, ready, go. No. Does that feel high quality to you?
No.
Ready, go.
No.
No.
are you're pulling out of the,
Ready, go. I'm pulling straight up, which is going to invert him a little bit there.
So this is the ISO treatment.
This is just
There you
testing
go.
QMMCs.
Okay.
So so how does this feel? Like the checking stuff.
why does this feel like
Can you grab higher up my ankle? Or sorry, yeah.
here?
Yeah.
Okay. Go ahead and hold down. Ready, go.
How'd that feel?
I mean,
High quality?
Yeah, I don't know.
Ready, go. Is that where she was holding initially?
Maybe.
Ready,
Yeah.
go. That feels high quality to me.
Yeah.
Ready, go. That's not happening.
Yeah, I don't know what the difference is, but
So,
I don't know. I can't tell.
so let me.
There's no one's high quality, one's not.
So check this out. Let me show you.
Maybe Jess, you're actually getting some like rotation.
Well, let me show you what rotation would feel like. Ready, go. That's rotation.
Yeah.
I'm pulling straight up. Ready, go.
Yeah.
Right? So the rotation feels strong.
Mm-hmm.
Ready, go.
Yeah.
That inversion thing from you feels strong. It's when I start driving you up and into eversion things get tricky. Think about when you pull. Let's try one more time, man. Ready, go. Yeah, that's not happening. Think about pulling. Yeah, go for it. No, I just want to feel what your hands are. Are you pulling with your fingertips or the pad? This part. Try getting from here.
Okay.
And then think about going straight up to the ceiling.
Okay, Eli, let's try this again. Show me what you got. Okay, ready, go. Am I not on the joint?
Let me see. Here, I'm gonna go with you here.
Okay. See if you like that's fingertips.
Okay. So right here.
Okay.
Keep it down. Ready, go. Ready, go.
Mm-hmm.
Ready, go. Ready, go.
Go. Ready, go. Go. I
Might be too high for you. The table might be too high too. Right? That
yeah.
could be.
Okay, let's try it. It's just as weird. It's just weird.
Okay, try that. Remember, okay, this is the other thing. Let me hop on here real quick. So you're getting here. This is immediately gonna skew your line of force.
Okay.
So look where I'm at here.
Yep. Okay.
I'm over him. And this is the thing about this stuff is your mechanic, there you go.
Ready, go.
It's feeling better.
She was just,
Ready,
she was
go.
standing
So your
back.
force is straight up and you're directly
That was
over.
all it was. She was here, pulling into E version.
Ready, go.
Maybe
Good.
get more further out on the.
On your met head.
Yeah.
Ready, go. Ready, go.
Can you do it more out?
More out
Feels,
here.
I think it feels like you're more in.
Like that pocket.
On the bone here, wrapped.
Okay.
Yeah.
Okay. Ready, go. Ready, go. On the bone.
Yeah. That's more.
Try that. See what that. Try that. Yeah.
Ready, go.
Yeah, that feels better.
Ready, go. Yeah.
Yeah, you're getting that. It's moving now.
Ready, go. I don't know. It just feels like it's an inversion or eversion.
Ready, go. It's a what?
Like I'm pulling his foot out.
That's correct. Right, because so if you think about this, like from a midline standpoint, if I'm pulling up, I'm driving him into
Okay.
eversion.
And I'm pulling straight up.
Correct, which is going to pull him into inversion. Right, and you got to think about what that metatarsal head does when it drives down.
Yeah.
Is everts him.
Okay.
Right, but we don't want to pull around because that's a very confusing test. Right, unless we were force coupling the whole foot. Ready, go. Ready, go. Never done that test before. Ready, go. That's kind of cool. Go the other way. Ready, go. Whoa. Ready, go.
How have you never done that test? Just
When have we ever force coupled a fifth and first?
oh, like
Ready,
why not?
go. I know.
Because you're doing that from the only
That's
the
like
calcaneus.
rest. That's full. That's crazy, man. Stay here. Ready, go. I don't even know what to do there. Is that? I don't even know if it's possible to do that in the body.
Try on this side.
Ready, go. Oh yeah, it is. Go the other way. Ready, go. Nope, don't have that. What? I need to write this stuff down, man. It's crazy. You need to go?
Oh yeah, I do need to.
Yeah.
And I guess you guys have your feet with you.
Yeah, take the feet with it. I wish I could do that.
Whoa, test to add. What's that? First? No, it's fifth. Phalangeal P/D flex Was there another one too?
It is.
I think it was.
I don't know,
Two,
body.
right?
The force
Doing the right
coupling.
force
Yeah,
direction and
No, it's crazy.
the right hand.
Was there one more?
And that was just a QMA.
Yep.
I mean, like all the stuff that we did.
So
No,
different
there
on
was
this
just-
side of it?
Yeah,
Yeah,
just-
I know.
Yeah, just
I
now.
know.
There was
I
like
just
two
focus on
things,
doing
but
as
it was.
I'm told.
You forced a couple of
I
both
know,
sides.
it's
Yeah.
so hard.
I thought both
To
things
be
were real.
honest,
One
Yeah.
side and the only one.
Yeah.
James
Was there another thing I was
been
saying
with
that we
people
should
for
add
so
into the
long, and
assessment,
they're up
though?
Yeah, there
whatever, and I'm
was.
like, oh, okay, so this,
It
look at
was,
this, look at this. And then I get off the table and I'm
That's the fifth.
like, okay.
I was grabbing
I
the
think it's good
heel
to stay
and
in
then
your body when you're on here. Because a lot of times
Oh,
it's really
sides,
hard for me
no.
to get
Damn.
my session.
Oh, we can look again.
And-
Oh yeah, oh
Yeah.
yeah, dude, that's
Um,
right.
Yeah.
Good
All
call.
right.
to the study
Dude,
mode.
So,
have a good day, man.
Because I'm like,
See you
biased.
too.
Right.
Bye.
All right.
See you later.
I'll be back Friday morning, same.
Friday morning.
I have a Friday afternoon appointment with you, and then I'll
Yeah.
just study the rest of the
Cool.
Okay.
Perfect. Are you
Alright.
gonna drop in shadow? Or
Is there a review, a study session Friday mornings?
No.
No, just Wednesdays?
Wednesdays? Yep.
Wednesdays, okay.
Yes.
Okay.
Yep.
Then I'll just come early and study.
Cool. Or shadow. Or
Okay.
whatever you want. Yeah, I mean you're welcome to drop in.
Okay.
And shadow and yeah, and we'll figure out a plan moving forward. I mean you're dropping in on like the back end of like the very end of.
Yeah, I have to learn how to touch the patients in the right way.
Well, you know
I
you're
mean, there's some stuff.
you're
okay,
totally good. It's
the
just
force,
no.
the direction of force, stabilization of the joint. Or,
I mean the other thing is just like knowing what we're doing here too. So
right.
I mean we've gone through like 16 weeks of
Okay.
positional testing and everything.
right.
So you know there's yeah.
Oh, you have it all laminated. Okay.
Yeah.
I love this. You finally went over this, and I'm like, oh yeah.
Yeah, it's
Okay.
pretty. Isn't that pretty crazy?
Yeah, like.
Yeah, and